going to look at the points of palpation, our stress points on our horse. These are the points that you can test to see if the muscles of your horse are sore. The first one is up in the head obliques. We put a bit of pressure on the head obliques towards the mane, and you can see I get very little response. The next is down the brachiocephalicus. We're just going to lightly palpate it the whole way down. And you can see that causes her very little pain. She seems to quite enjoy it. When you get to the base, squeeze that one quite tightly. Then we move on to the point of shoulder. We're just going to put a bit of pressure on it. She doesn't mind that at all. Moving to the spinalis muscle over the wither, just put a bit of pressure up towards the wither. We get very little reaction. As you test the back, you don't want to run your fingers along the spine because that will cause a reaction in most horses as you run along the ligament. But you want to make one line about 2 fingers down from the spine and another just above the shelf of the ribs, and you want to run 2 little zigzags across there. So you can see as we get to the back, we're getting a tiny reaction a little bit further back. Then you run your second line. And we don't get much reaction at all. Then we want to move to the tubercoxy, and we just want to apply a little bit of pressure on top. And you can see we're getting a bit of a pain response there. Moving up to the tuber sacralis, you just want to pinch them together. They're a little hard to see on a round horse like this. But there is not a lot of pain there. Then you want to move to the point of the hip, and you just want to do a little circle just around it. And we can see there's also not a lot of pain there. Now look at the balance and symmetry of Quay. You can see that her left scapula is bulgier than her right scapula. The heights are about the same, but there's definitely more bulk on the left side than the right side. As we move back and have a look at the symmetry of her hindquarters, you can see that even though she has some issues in her pelvis and stifle on the left side, that the symmetry of her hindquarters is quite round. If we were to actually feel her tubercoxes, they are quite even and level. Then as we go down and look at her hocks, have a look and see if the symmetry of the hocks is the same. Are they equal height and are they facing in equal directions? And then same down to the pasterns. Are they equal height and facing in equal direction? If we look through to the front legs, are they pointing forward? Or as you can see, they're actually both pointing out quite a bit. She's definitely not standing with her fetlocks and her hooves facing forwards. We're going to look at evaluating a horse in motion. We're going to watch the horse move away from us, and we're going to look at whether she hikes her hips evenly, whether her tail is flowing and straight, and how she places her hind feet. So you can see she actually lifts that right hip higher than the left one, and her tail is off centre. As she turns, look at whether she crosses her feet evenly. When she comes towards us, look at how she places her feet. Are they crossing in front of each other or are they on 2 tracks? Then she'll turn the other way. Does it look easier or more difficult? So as she goes back again, have a look at her hindquarters and see how the right side is lifting higher than the left and how the tail is off centre, and she's actually placing her left foot out a little bit. Then watch as she doesn't cross under herself on that circle. As she comes, you can see that her right foreleg is facing inwards a little bit, so it nearly crosses in front of the left. Clip, we're going to watch Quay trotting. Look for the same things that you were looking for in the walk. Are her hips moving evenly? How is she placing her hind feet? And how is that tail? As she comes back towards us, see if you can see the hips behind, but also look at how she places her feet. You can actually hear a toe drag with that left foot. As we watch her go again, look for the same things as before. Is she hiking the hips evenly? How is she placing the feet? Is she placing them on two tracks? Is she plaiting? She doesn't look particularly happy about it, so you can tell it's uncomfortable for her. So you'll notice now that she's placing the white foot a little bit differently to the others, and she's dragging it slightly. In this video clip, we're going to watch Laurel, an ex-racehorse, in dynamic motion. So the same as with the mare, have a look at the swing of his hips. Does he hike a hip or does he drop a hip? When I look at him, I see him dropping the left hip. As he turns, does he cross his feet evenly? How does he place his front feet? You can see that he turns out with the right front. Does he drag his toes or does he pick them up nicely? Turning this way, is it easier or more difficult? You can see that that's quite difficult for him. He takes a while. Have a look again. Does he place his feet evenly? You can see the toe drag a little bit more from the back. Does he hold his tail evenly? And have a look at that pelvis again. He places that right fore with a little bit of extra care as well. Video clip, we're going to watch Laurel trot. Look for the same things that you did in the walk. Does he step evenly? You can see he plaits a little with his hind. You can see the unevenness in his hips. As he comes towards us, look at how he places his front feet. You can see that he wings a little bit with that right fore, and the toe drag is a little more obvious. As he goes off again, watch those hips again and have a look for that slight toe drag. You can see how he kicks the dirt up. Look also at the hocks as they're trotting away from you. Do they look like they're moving freely, or do they look like it's a little bit hard? As he comes back towards us, have a look at that right fore again. Is it coming from the knee or the hoof or the shoulder? In this video clip, we're going to look at the palpation of the stress points of the horse. So we start with the head obliques, and we want to apply a bit of pressure with our thumb on the head obliques up towards the mane, and you can tell that that's quite painful for him in the middle there. Then you want to move to the brachiocephalicus, and you want to gently palpate either side of the cervical vertebrae. And you can see as we come down over his 5th, 6th and 7th that it's a bit sore for him. And then right at the bottom here, it's spasming quite a bit. And we want to palpate the shoulder joint, and he's actually moving away from pressure to the shoulder joint. Coming on to the wither, the spinalis muscle, you just want to gently apply pressure towards the wither. And you can see that he's got a little bit of spasming over that. You don't need to use a lot of pressure, just as if you were giving him a bit of a rub. Palpating along the spine, We want to palpate about 2 to 3 fingers down from the actual spine, and then just above the shelf of the ribs to make sure we're off all the spinous ligaments. And we just want to zigzag with our thumb. So you can see that there's a bit of dipping, and actually the tissue gets hard as you get towards the back. Then do it a bit lower so you cover all the back muscle. So there's quite a lot of spasming going on. He's quite sore there. Coming over the tubercocci, you just want to apply a bit of pressure down, and you can see that he's finding it hard to be stable. We'll just get him to put weight on that foot. Then over the tubus sacralis, just squeeze them together. There should be no movement there. You can see we have quite a lot of movement. And then lastly, the point of the hip, we're just going to do a circle around it. And that's quite uncomfortable for him. Good boy.